Well, good evening. I'm Dr. Craig Gill, and welcome to my lecture, Heart Health, an Inside Look at What You Need to Know. Let's get started. DHS, that's me. I want to say something first before I get started. I want to thank Dr. Sue Tent, and the entire staff here at DHS for welcoming me aboard. It's been fantastic. I'm looking forward to the ride. Blood type analysis more than meets the eye. I'm going to do my lecture July 7th on blood types and how they interact with certain nutrients, how different blood types respond to different nutrients. I think it'll be a fantastic lecture for you guys. You're going to learn a ton about blood type. You're going to find out that there's one blood type out there that only 49 people in the world have. In fact, they're on a secret list with the governments just so that they can identify one another and share that blood type if it's needed. Dr. Tent's lecture coming up April 7th. Where are we now? You're not going to want to miss that. Dr. Tent always puts on a great lecture. Dr. Jeff's lecture, top 20 products. He's going to feature the top 20 products that he likes. That'll be a great lecture. That'll be May 5th. You can follow us and do appointments with us on Skype or Zoom. We do those appointments every day. What a great way to reach out to your family across the country or wherever they might be to get an appointment with us, do blood work analysis, things like that. Like us on Facebook, subscribe on YouTube, watch our DHS protocols. You pretty much can find us everywhere. Instagram, YouTube, Facebook. Follow us on those. You'll see some of our compilations of adjustments and things that we do for patients. A lot of times I'll do infomercials on there about different products. Well, what we'd like is this. What's your story? When you come in, you get treated by us, you have a success story, share it with people. You would not believe how many people watch our stuff and find out, hey, I didn't realize they treat that, or I know somebody that has that. It's all about helping the next person out there. So what's your story? Come on in and share. If you've been a patient here, had a success story, let's share it. Let's get started. Following government sugar guidelines increases the risk of heart risk in 2 weeks. My question is do you trust the government with your health? With the fiasco that's went on in the last year, I think that's the last thing I'm going to trust the government with. Here's what we see. The American Heart Association recommends about 6 to 9 teaspoons of sugar a day max per day. On the other hand, the federal government says, go ahead, 25% of your caloric intake you can take in as sugar. I don't know. I have always been told maybe you should follow the money train on this one. So, what did they say? Significantly increased their measures of heart disease. The findings demonstrated that several factors associated with elevated risk for cardiovascular disease were increased in individuals consuming 25% of the calories from fructose or high fructose corn syrup. But consumption of glucose did not have the same effect. They also increased their levels of apolipoprotein B, a protein which can lead to plaques that cause vascular disease. Apolipoprotein B has been shown to be a better predictor of cardiac events than LDL cholesterol. I always say if you have the diabetic in the family, start with getting rid of the corn syrup first. Some hidden places you'll find corn syrup. Mac and cheese, yogurt, cocktail nuts, tonic water, salad dressings, and barbecue sauce, just to name a few. Remember I said follow the money? Congress invests big in pharmaceutical tech stocks. Pfizer is one of the most popular stocks in Congress, with 48 lawmakers placing their bet on the drug maker that hikes its price each year. In the most recent financial disclosure filed last year, lawmakers reported holding tens of millions of dollars in tech and pharmaceutical stocks. Most popular investments in Congress, here it is. In addition to pharmaceutical and tech companies, big banks and energy giants are among Congress' favorite stocks. These figures are from lawmakers' most recent financial disclosure, May of 2019. Look at this. Nancy Pelosi owns $46 million in Apple stock alone. You got 79 members there, 65, 54, Bank of America, Apple, all the different stocks. Look at the minimum investments, $9 million, $2 million, $1 million. The average congressman, senator makes $177,000 a year. Interesting that they got this money to invest as much in stocks, isn't it? I'll stop that talk and move on. I don't want to take that bus ride into the Grand Canyon because I haven't seen it yet. Now, millions take these blockbuster drugs for heart protection, and yet they are actually killing the well-established heart protective properties of fish oil. Low control group statins use of high DHA-EPA ratio was associated with higher reduction of total mortality. In other words, the lower the statin, the more DHA-EPA that you take, the better the reduction in mortality that you have. In other words, the statins actually fight against the fish oils, and therefore mortality goes up. Let's read this. World-renowned heart surgeon renounces mainstream heart health practice. We physicians, with our training, knowledge, and authority, often acquire a rather large ego that tends to make it difficult to admit we are wrong. So here it is. I freely admit we're being wrong. From his experience as a heart specialist, he realized that statin drugs are more dangerous than cholesterol itself. Cholesterol is part of a necessary physiology. He points out that the healthy fats do exist and they're important. Let's remember something here. When you're taking, when you're talking about these statins, there's a $7 billion a year they sell in statins. But remember what statins do. They block HMG coenzyme reductase, which is an enzyme that stops all of cholesterol production and all of CoQ10 production. What happens when that happens is it can affect memory, brain healing, hormone production, and protection of the cell wall. Remember, you got 7 trillion cells in your body that all have a cell wall made out of cholesterol. You start robbing that cholesterol, that cell wall, you're going to have problems. That's quite a side effect. Taking statins for cholesterol doubles your risk of developing type 2 diabetes, scientists warn. The researchers discovered that people who take statins had more than twice the risk of being diagnosed with type 2 diabetes than those who did not take the drugs. Studies also link statin use to problems such as memory loss and dementia. Around here, I call it pseudo-Alzheimer's. They start taking the statin, they get the muscle cramp pain, and then they start to forget where they put the car keys. Heart stents fail. Shocking study shows heart stents are medically useless. However, a new study that was published in The Lancet could cause the popularity of this procedure to plummet after revealing that there was no more difference between patients who were given heart stents and those who underwent a sham procedure. This is what they did. The cardiologist, nobody knew what was going on. They took the catheter, went up, they found the blockage in the coronary artery. In some of the people, they would put stents in. In the other people, they put nothing and came back out. This is what they found. For the study, the researchers and patients were not privy to who had been given the stents, and all the patients were given drugs to prevent blood clots after the procedure. 6 weeks later, both groups reported having less chest pain and performed better on treadmill tests than they did before the procedure. So the people without the stents were performing as good as the people with the stents. Are you trading heartburn for a heart attack? Why do proton pump inhibitors increase the risk of heart attack and death? But a new study finds that these drugs may calm heartburn at the risk of having a heart attack. Are linked to high risk of myocardial infarction and death. People taking PPIs were 16 to 21% more likely to suffer a heart attack and 122% more likely to die from cardiovascular disease. The data revealed that GERD patients taking PPIs had a 16 to 21% increase in risk of heart attack. The research theorized that PPIs inhibit the enzyme activity of nitric oxide synthase in endothelial cells. What nitric oxide does is allow the contraction and expansion of the artery. So when you have the nitric oxide in there, they can expand when blood pressure goes up and contract when it goes down. If that doesn't happen, we can have blood pressure effects and risk the heart attack. Hackers easily override heart monitors, delivering potential deadly shocks to heart. Listen to this one. Researchers used a personal computer, a wireless radio, an oscilloscope, and a few antennas and a free software to hack into the software controlling implantable cardioverter defibrillators. But by gaining access to the device, the researchers were able to disrupt the operation and even use it to administer a powerful shock that is said to feel like a kick to the chest. I don't know about you, but I don't want the high school geek being able to control my heart with a little laptop, a couple of antennas, hit a couple buttons, and all of a sudden I'm jumping out of my chest. No, thank you. Taking aspirin daily prevents heart disease, may be due to do more harm than good, says scientists. But in 2018, 3 clinical trials revealed that taking aspirin for exactly those purposes actually does more harm than good. The results showed that taking the medication daily offers very few benefits and even elevates the risk of bleeding. As of 2019, the new AHA and ACC guidelines recommend against the use of aspirin among adults age 70 and above who do not have a history of heart disease or stroke. Now, what does the aspirin do? It monkeys with what they call the COX-1 reaction in the body. When you monkey with the COX-1 reaction in the body, what happens is you can't control inflammation and you can't control the protective mucus lining of the stomach. When that mucus lining goes away, you start to burn that stomach lining, called gastritis, and the next thing you know, you can form an ulcer, which can potentially bleed. Social stress leads to atherosclerosis, research suggests. Can you imagine? Look at the stress that's been going on. We see it every day here. Fear, anticipation, anxiety, physical and emotional stress. Who doesn't have that these days with everything going on? But they're finding out, several large studies have clearly shown that there is a correlation between physiological stress and the risk of developing cardiovascular disease. The scientists discovered that social stress increased blood levels of different markers of inflammation, which previously had been shown to accelerate the development of atherosclerosis. So stress, we see it daily. It's unbelievable to me how many people have been coming in with anxieties of recent. The emotional side effect of heart failure. Why do heart failure patients become depressed? Have you ever been in a hospital after a heart attack or something? You're in a room and you hear this beep, 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 ding dong, beep, 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 and God forbid if the nurse comes in and had a bad night. This throws off your circadian rhythm of your heart. When you come in, if the patients come in, or when the nurse comes in and she's interrupting your sleep, or she's interrupting what you resting to heal, this leads to this depression. Sitting too long can change the shape of a heart and increase cardiovascular disease risk. Exercise is key to reversing the damage, says experts. Anybody remember Jack LaLanne, the juice man? Jack LaLanne was the first guy that got on TV and did this. He was the first exerciser on TV. The cardiologist back then said, don't do that. It's damaging to your heart. That is not a good thing to do. What are we finding out? Exercise keeps the fluids moving. Exercise will prevent plaque from forming. Despite these findings, the researchers are hopeful that the detrimental effects of cardiac change due to lack of exercise could still be reversed. In fact, several studies emphasize the importance of proper exercise in reversing damage to sedentary hearts. I don't know about you, but one of my fetishes is clean mouth. I like to power wash my teeth. Now, I don't use the 6-horse pump with gasoline in it. I like the little water pick, and I water pick my teeth each night. Why? Porphyromonas gingivalis is a bacteria in your teeth. They're finding this bacteria to be in plaque in the arteries. Let's look at this. Live oral bacteria found in arterial plaque. Gum disease has been linked to hardening of the arteries for nearly a decade, and scientists have long identified a gang of oral bacteria as the obvious suspect behind many cases of vessel clogging killers. Now, the exciting implication focus on the known ability of these bacteria to destroy connective tissue in the mouth, suggesting that when infecting the vessel wall, they may contribute to the instability of the arteriosclerotic plaque. What that means is that when the bacteria get into the vessels, they go up to the plaque and they're breaking that plaque loose. What happens when we break that plaque loose? It can go down the line, form an emboli, block blood flow to the heart, or block blood flow up here. This is a stroke, this is a heart attack, just from bacteria in the mouth. Unbelievable. Autopsy-based studies examined prevalence of atherosclerosis among U.S. service members. Risk factors such as hypertension, diabetes, cholesterol, and smoking, okay, there were the risk factors. The prevalence of any coronary atherosclerosis was 8.5%. Severe coronary atherosclerosis was present in 2.3%, moderate in 4.7%, and minimal in 1.5%. The researchers found that age consistently produced the strongest association with the prevalence of atherosclerosis. Several members with atherosclerosis average age 30.5. 30.5. In today's world, plaque can start at what? 20 years of age. Why? Look at our diets. We got chocolate milk coffee out there, which we get at some of these coffee shops. Look at the fast food places. Since we shut everything down, there's lines around the building every night. This is not good. The average age is starting at 30.5. The older you get, it gets worse, 7 times worse. But these guys are under immense stress. I wouldn't want to be on the military line, but the plaquing in the arteries is starting younger is what I'm getting at. Surgery, a risk for heart damage. Increased risk of death from heart cell damage found to occur during and after non-heart surgery. Older patients who have had a non-heart surgery increase their risk or chance of dying by 6 times a month following operation. These procedures included surgeries on the body parts that are far from the heart, such as knee surgery and prostate surgery. So if you go in for a surgery, depending on age, and you're getting a surgery on the ankle, the knee, a hip replacement, you're increasing your risk of damage to the heart muscle. 1 out of 7 patients aged 65 years and older who undergo surgery that doesn't involve the heart experience damage to the heart cells during the procedure or after it. Preoperative myocardial injury is what it's called. Now, this is what I like for heart support. The omega-3 EPA DHA is fantastic for that calcified aortic valve. This has been found to be a miracle for that. Cataplex B core. Now, I want to talk a little bit about the Cataplex B core. What I like about that is there's thiamine in there. Now, for another situation, helped a lot of marriages with this. When you're low on thiamine, what happens? You can get very emotional. It affects the frontal lobe of the brain. What does alcohol like to remove? It likes to remove B vitamins, specifically thiamine. When that thiamine is removed and that frontal lobe gets affected, you become either extremely emotional or extremely angry. This reminds me of a roommate in college, Rob. You're out there, Rob. I know you're watching. He would have that 3rd beer, and the next thing you know, we would chase him away from the bouncer because he was low on the thiamine. Thiamine helps to balance out that frontal lobe that makes you pleasant and happy. Now, Cardio Plus, that's a fantastic product. We rebuild the hearts with that. Resveratrol HP is the French paradox, Resveratrol. And then the Cytozyme H. That product's a great product. I had a female patient come in. She was pregnant. Her name was Erica. She was very upset because the doctors had told her, look, once your child is born, we have to do that open heart surgery to perfect that or to fix that heart defect in your child's heart. She came in, she said, Dr. Gill, is there anything possible we can do? We put her on 10 of those a day during the remainder of her pregnancy. She delivered that child. That child is approximately 10 years old now and has not had the surgery. Maybe it's God, maybe it's the nutrition. I think a little bit of both. Drugs for heart disease cause heart attack or stroke. Instead of preventing cardiac problems, it increases the incidence of heart attack and strokes. The treatment was stopped on October of 2005 when CIMT, which stands for carotid intima media thickness, testing revealed that there was no difference between thickness of the arterial walls in those taking paclitaxel and in those taking placebo. In fact, after 6 months of treatment with paclitaxel, low-density lipoprotein cholesterol increased by an average of 7.3%, compared with only 1.4% in the placebo group. An even more disturbing outcome was noted in the people taking this drug, a statistically significant increase in cardiovascular deaths, heart attacks, and strokes. Now, I don't know about you, but what happened to the people before October of 2005? That's what I'd like to know. I had a patient, if you remember this one, Vioxx. Remember Vioxx? Vioxx was the one for arthritis. I had a patient come in. He didn't want to spend the money on nutrition. He said, look, doc, I just want the treatments. Treat me. He was taking Vioxx. What do you think happened? Vioxx also caused heart attacks. He suffered a heart attack and didn't make it through. I don't know. Some of this stuff where we're taking pills that are supposed to prevent things and causing things. All right. Blood type may influence heart disease risk. Harry, this one's for you. This is what I've been doing here at DHS. I do a lot of blood type stuff where I kind of take the blood type of the person, I put together the nutrition of what they need for that blood type to get the results. Now, the American Heart Association Journal has found out that blood type ABs have a 23% increased risk of disease, heart disease, where the type Bs have 11% risk and type As have a 5% risk, putting type Os at 0 to 5%. Harry, that one's for you. Flu vaccine found to increase heart attacks. But Dr. Gill, they're free at CVS. Flu vaccines result in inflammatory cardiovascular changes indicative of increased risk of serious heart-related events such as heart attacks. But Dr. Gill, they're free. CVS is giving them for free. Sometimes it's not worth it to get the cheap stuff. All right, let's move on. How diabetes drives atherosclerosis. High blood sugar results in production of free radicals, which causes premature cell death. High blood sugar reduces the ability of nitric oxide, which would enable the blood vessel to relax and increase blood flow. But remember, the government says 25% of your caloric intake should be sugar. Sugar consumption plays a greater role in heart disease than saturated fats. Consuming a diet high in sugar for just a few weeks has been shown to cause numerous abnormalities found in patients with congestive heart disease, such as total cholesterol, triglycerides, LDLs, oxidized LDLs, uric acid, insulin resistance, and abnormal glucose tolerance, low HDLs, and altered platelet function. The overconsumption of added fructose undoubtedly increases the risk of obesity, which is also a risk factor for congestive heart disease. Excess fructose also markedly increases the risk of non-alcoholic fatty liver disease. That'll also increase the risk of hip replacements. Remember, the fatty liver release those droplets of fat. They'll plug up those small arteries, especially in the hip. The most common liver disease in the U.S. and a strong independent risk factor for congestive heart disease. Sugars occurring naturally in fruits and vegetables pose no increased risk of congestive heart disease. I would be careful on the fruit. I wouldn't get carried away on the fruit. Large amounts of fruit, let's remember, fructose turns into a double glucose molecule in the body. That comes from fruit. Calcium levels in the heart, a potential biomarker for heart disease. Somebody needs to tell this to all the folks in Florida. If you go down to Florida, you'll see all these people with big jugs of calcium on their counter because they think calcium is going to get rid of their osteoporosis. Let's explain that. There's no peer-reviewed literature out there that says that calcium by itself will reverse osteoporosis. But they all have it down there in Florida. They're all taking it. They walk around like the Tin Man. Their bones are see-through. It's probably time that they balance it out with something different. Now, when we give calcium in the office, we usually will give it with calcium, magnesium, potassium, or just straight magnesium. What you have to remember is they're antagonists of one another. In other words, too much calcium will push out magnesium. Too much magnesium will push out calcium. We give them together because they'll auto-regulate. In other words, there's too much calcium and not enough magnesium, and you give calcium, magnesium, what will happen? The magnesium will come up, the calcium will push off and create that balance that you're looking for. But be careful with how you do your calcium. Okay. How the protein SRB1 promotes atherosclerosis. This is where we get into the thick of it. The researchers found that prior to the formation of plaque and lesions, both SRB1 and DOC4 are highly expressed in regions of the mouse aorta, the main artery that carries blood away from the heart, that are prone to atherosclerosis. At the start of this work, it was significantly unknown how LDLs entered the arterial wall to cause cardiovascular disease, he said. The paper's findings solved the mystery and countered many scientists prior to assumption that LDL simply enters through sites of damage or disruption in the single layer of the endothelial cells that serves as the arterial wall protective barrier. Now, what does this mean in English? I'd rather you see it than talk about it. So this is my artistic ability, not too good. But these are your LDLs in the blood. These are your endothelial cells, okay? This is the interior of an artery in the body. You have LDLs floating around because of too much saturated fats, too much sugar, or too many carbs. What happens is, this is the SRB1, the DOC4. What happens is these bind the LDLs. And once they bind the LDLs, they pull the LDLs in through the arterial wall, which creates inflammation within the arterial wall. That inflammation goes out and stimulates the immune system to make monocytes and release monocytes that now come along, go into the arterial wall. There are these green things here, and the monocytes turn into macrophages, which gobble up these LDLs and become what is known as a foam cell. Once they become known as a foam cell, that foam cell builds and gets trapped in that endothelial wall, and now what happens, it starts to bulge out. You get other inflammatory factors that come in, other minerals that attach to that, and now you got a hardened scab inside the artery. That's what plaque is like. Now remember, if that bacteria from your mouth gets into the blood, what happens is it comes along and it can rattle this plaque, break a piece of it loose, and that could potentially go down, create an emboli to your brain, stroke, or heart attack. Other things can do it too. It also does this. It narrows this opening of the heart. And as that plaque builds up more and more, what it does is it narrows down that artery more and more and more, which decreases the amount of blood flow to whatever it's going to, whether it's brain tissue, heart, lung, or what have you. How do macrophages play a role? The scientists took cell samples from a healthy aorta and an atherosclerotic aorta and sequenced them. They identified two types of macrophages, one in the disease vessel, namely monocytes, and the other so-called dendritic cells that derive from monocytes. In healthy vessels, they found local macrophages and several other immune cells. Now, this is one of the things that I was talking to Harry about, a big chemist, that they're going to write up in a book. If you have somebody out there with slightly elevated monocytes, but they don't have any of the other inflammatory factors that would relate back to monocytes, start thinking plaque or plaquing, because the monocytes are released to go to that damaged cell wall to engulf all those LDLs as macrophages. So your monocytes on blood. In fact, what you'll see, what I found, increased monocytes, decrease MCV on blood work, and increase LDLs for the doctors out there. With a normal total protein, you better start thinking there might be some plaquing going on. Now, surprising fact of lipoic acid. Supplements of lipoic acid can inhibit formation of arterial lesions, lower triglycerides, and reduce blood vessel inflammation and weight gain. The study found that lipoic acid supplements reduce atherosclerotic lesions formation in 2 types of mice that are widely used to study cardiovascular disease by 55% and 40% respectively. The supplements were also associated with almost 40% less body weight and a lower levels of triglycerides in very low density lipoproteins. The amount used in this research would not be obtainable from a normal diet. Researchers said, and for human consumption might equate to supplements of about 2,000 micrograms per day. In other words, you just can't get enough from the diet. 2,000 micrograms per day from supplementation is needed. Here it is. LPA plus is what I use here. Now, how would I use it? Well, in a maintenance dose, maybe 1 to 2 a day. But in somebody that's got a higher risk, I'm going to probably go as much as 3 to 6 a day, depending. Now, it's scary to me about plaque. Why? A couple questions I have when I get up there is this. Here's the heart dissected, cut in half. Here are the openings to the coronary arteries. If you look at the size of those at the aortic valve, they're about the size of a pea or maybe smaller. To me, it's not going to take much plaque to clog those up. Here they are on the outside of that heart. Here they are, 2 coronary arteries, the left and the anterior right, and they show how they feed the whole heart. But with a size opening, maybe the size of a pea, it's not going to take much plaque to clog those up. That's scary to me. Now, red flags for the heart. That bruised feeling in the chest. When they come in and tell me, I got that dull bruised feeling in here, I start to wonder. Especially if they're carrying things upstairs, they get winded, or after a sporting event, when they stop the sporting event, they're driving away from the sporting event, they get those twinges of pain around the left breast, or they get that dull, achy feeling. That bothers me. I'm going to check them to make sure they're not clogging up. Now, different indigestion than normal. What I mean by that is recently I had a guy call and he said to me, he said, my heartburn is killing me. I said, let me ask you something. Is the heartburn you're perceiving today different or the same as what you're used to? He said, it's different. I said, okay, first red flag. Now, is that heartburn reflux getting worse as the day goes on? He said, yeah, since morning it has gone up a little bit. I said, stop what you're doing, go up to the local emergency and get the troponin levels checked. Sure enough, he was having a heart attack. I always warn about that reflux that you have that changes. So if you have reflux and you get a different reflux on a different day, remember that, okay? Now, for the doctors out there, bamboo spine. Time and time again, this has been correct. If you have that patient that has that very rigid upper back from T1 to T4, as a matter of fact, it could be all 12 thoracics, the upper back, but you have that bamboo spine where you're adjusting, and nothing's moving, think of this. It could be a viscerosomatic reflex. What is that? It's when the organ sends a signal back through the nerves back to the area of the spine where that nerve came from. It will tighten up the muscle in that area of the spine, cause inflammation, and cause that area of the spine to become very stiff. The x-rays will show nothing. You'll take a thoracic AP lateral and the x-rays will look normal. But then you put them on the table to treat them and they feel like you're trying to adjust bamboo. Start thinking stroke and heart attack. Start thinking, let's check some things, some factors that might be associated with clogging of the arteries. All signs to a looming heart attack. Now, cayenne pepper is very beneficial. They say it'll stop a heart attack in its tracks by taking 2 teaspoons of cayenne pepper. It might be something you want to keep around the house. Actually, I'd go after treating the maintenance of it first. Now, this is magnesium. This is what I call the non-poop magnesium. We use this for the heart. Typically, we'll put people on that at night away from food. We don't take magnesium with food because magnesium with food a lot of times will create a metabolic soap, and that metabolic soap is called gas. Now, Cataplex E2, I love this product here. They use it at Mount Everest. When people go through what they call the death zone of Mount Everest, they take this to prevent what they call the reverse of the bends, which is very deadly. What this does is it dilates the coronary arteries to get more oxygen to the heart. It's a fantastic product. I've used it for years. Those people that pull up the trash can from the curb and they start to get that shortness of breath, or if they're talking really fast like me, and all of a sudden they, in between each sentence, they're doing that to you, that is a fantastic product to dilate those coronary arteries and get blood to that heart. Here's another thing we have to watch for, heart attack imposter, called a hiatal hernia. Now there's 2 types, paraesophageal and sliding, for the doctors out there, but let's just get to this. Hiatal hernia is when part of the stomach crawls up between the diaphragm and creates a gas pocket above the diaphragm. Why is that a problem? Because above the diaphragm sits the middle mediastinum where the heart sits. The heart sits in the middle mediastinum. Now, any little pressure on the heart irritates the heart. So that hiatal hernia, putting pressure up on that heart, is going to give you shortness of breath. It can give you everything from a sweating feeling to even a little bit of numbness in the neck. I've seen people go to the hospital at 3 in the morning with a hiatal hernia attack, swearing that they're having a heart attack, and the doctor says, go home, drink water, you have a hiatal hernia. Why? Well, we have to be careful what can cause hiatal hernias. One is excessive consumption of coffee, grains, carbohydrates, mixed with sugars. That can all cause the hiatal hernia. A great way to fix these is a treatment that we do at the office where we put the pisiform bone and we pull this down back through here. You'll even hear it. I call it an internal burp, and you reduce that hiatal hernia, and immediately when the patient gets up or drives away from here, they'll say, I can't believe the difference. I don't feel that heaviness up here anymore, and I can breathe easier when I'm doing things. So make sure you look for the hiatal hernias, docs. Now, don't blame genetics. Poor lifestyle habits play a greater role in young patients with heart disease. A recent study presented in the European Society of Cardiology, or Cardiology Congress 2019, revealed that lifestyle habits play more of a decisive role in early coronary artery disease than genetics. A person with a family history of heart disease doesn't necessarily have to suffer the same health consequence later on in life. Very true. A good book to read called Deep Nutrition. Deep Nutrition in that book talks about how nutrition can bend genetics. So if your uncle Larry, Curly, and Moe had a heart attack, your dad had a heart attack, your grandpa had a heart attack, it doesn't mean that you have to have a heart attack. Getting on the right nutritional program can bend those genetics and change it. The researchers found that those who practice a healthy lifestyle reduce their heart disease risk by 50%. Next. Simple steps. Introduce good fats. Avoid MSG, monosodium glutamate, which is known neurotoxin. Decrease blood sugar intake. After a heart attack, a healthy start or heart starts with great nutrition. The 884 patients that frequently ate fast food before the heart attack, 503 of them continued to do so despite the recent attacks. in this matter of mere, is this a matter of mere unhealthy convenience or something more? Consuming saturated fats and sugar in high amounts are thought to hijack natural brain processes, causing the overproduction of opioids. Opioids are produced naturally by the brain, but overproduction can give way to self-intoxication, leading to addiction, much like you would see in heroin addicts. Imagine that. You eat some fast food, opioids in the brain, you start feeling like, I'm addicted. I see a lot of kids addicted on a daily basis. Okay, here we go. Eating healthy comes with its challenges. Eating healthy comes with its challenges. Here's why. In 1954, this company here, called the Vitamineral Company, studied the United States soils. They found all these mineral deficiencies across the United States in the soil. Now, if we're trying to grow a healthy plant, if you're a vegetarian, you're eating the plants. If you're carnivorous, you're eating the animal. If you're omnivorous, you're eating both. But here's the thing. The plant has to be healthy first. If you're low in minerals, water in the plant, photosynthesis, you get a healthy plant. What makes a plant organic? A plant is organic based on, did it have to struggle through drought, flood, heat, and cold and continue to grow? It fought through all that. It produces more phytochemicals when it fights through that. But if you don't have healthy soil to begin with, you don't have the minerals there, guess what? You don't have the healthy plant. You don't have the healthy plant, the animal doesn't eat the healthy plant. If you eat animal, carnivorous, well, that's not going to be healthy. Or if you eat the plant, it's not healthy. Earthworms. Who remembers these? Remember when it used to rain? When it used to rain, you'd go outside, you'd see 1,000 earthworms on the street. You'd pick them up, throw them in a bucket, and go fishing. You didn't have to go to a bait store. Or like me, you'd pick them up and chase the girls down the street and laugh. Today's world, the girls pick up the worms and they chase the boys down the street. I don't know. Things don't make sense anymore. Some people are having, you know, on 4th of July, we used to put up flags on the front porch. Now there's people out there burning them. I don't get it. Things are changing. Anyways, earthworms, what do? The earthworms go down in the soil. They burrow through the soil. They aerate the soil. They bring oxygen to the root of the plant, and then their crap is picked up by the roots of the plant to grow. Yes, their excrement. There's been talk that an earthworm goes down 6 feet and then comes back up to the first 6 inches of the soil to distribute minerals and excrement to help the plant grow. So here we are. Heavy metals such as copper are known or are one of the factors that can reduce earthworms. But here's another one for you. You're sitting in your house, you look out the window, here comes the truck, pulls up. The guy puts on the spacesuit, he gets out and he gets on this motorized thing, rides across your grass. We used to call that giving somebody a lawn job. But he rides across your grass, spraying chemicals everywhere, and down the road your cat's got a tumor and your neighbor's fighting Hodgkin's lymphoma. I don't know if it's a good idea to always worry about the grass being green and putting chemicals on it, but it also takes out the earthworm that has a very functional part of keeping the plants healthy. Science lesson time. Because of the rapid increase in human population, food demand is also rocketed. Okay, let's go back here. Part of the reason there's a mineral deficiency is because the United States has been the breadbasket of the world for many years. In other words, we export a large amount of food. When we do that, what happens is farming techniques change. And when they change, that's another reason why the soils aren't what they used to be. Don't forget, we just signed $50 billion with China to export more foods. Many farmers are saying we don't have enough farmers to fill that bill. It's going to be great for the farmers, but what's it going to do to the soils? So, science lesson time. Agricultural chemicals are also known as agrochemicals, are a product used in agriculture to increase the production by controlling the object growth or by terminating possible pests. not the whole story. Look at, I'll leave these for you to read, but you can read through all these things and what they do. What is sulfur dioxide? If you can, it is very much encouraged to avoid the particular gas because of exposure to the gas for several times and intensity could lead to various health problems. How do we use it? Sulfur dioxide also acts as an antioxidant and it could maintain the appearance of foods. It keeps the foods looking good by robbing it of oxygen so that it doesn't rot. Is that really an antioxidant? I mean, I tell people all the time, that big giant tomato in the grocery store that looks like it was painted maybe isn't a good idea. It might be good to go out west, find that local farmer still using manure, look for that tomato that looks like it fell off the back of the truck and maybe was even run over. It's got more dense nutrient in it than that big bowling ball looking tomato that you find at the grocery store. I don't know if I want to eat some of these things that they're spraying on the foods too. The harmful effects of sulfur dioxide. The process inhibits photosynthesis. Isn't that how the plant grows? Photosynthesis? It has fabricated several major chronic issues such as deforestation, acidified waterways to aquatic life, and makes buildings and materials corrode. I'm not sure I want to eat something that makes a building corrode. I don't think that's a good idea. Potential dangers: reproductive disruptor, hormone disorders, cancer risks, subtle and delayed neurotoxic effects, respiratory problems, liver disease, developmental effects, immunological effects, cardiovascular effects or illness, multiple sclerosis-like disease, gastroenteritis, meningitis, otitis, and DNA mutation. That should be enough to scare anybody away. What is glyphosate? Monsanto. What is glyphosate? Glyphosate is the active ingredient in Roundup, the most widely used herbicide on the planet. Glyphosate enjoys widespread usage on core food crops, in large part because of its perceived non-toxicity to humans. The glyphosate will be present as a residue in derived foods. Unfortunately, weeds amongst genetically modified Roundup ready crops are developing ever-increasing resistance to Roundup, which requires an increased rate of herbicide application. Levels in food and water are rarely monitored by the government agencies. These are some of the things that glyphosate does to the human. Can induce human breast cancer proliferation, risk of mammillary tumors in females, breast tumors, risk of kidney and liver damage in males, shortened lifespan in both males and females, vitamin, mineral, amino acids, neurotransmitter disruptor, gut bacteria disruptor, impaired liver ability to detoxify, can disrupt biohomeostasis, likely cause of the recent celiac epidemic, linked to non-Hodgkin's lymphoma, considered a neurotoxin, linked to anxiety disorders, increased diabetes, plays a critical role in kidney failure. That's what the glyphosate Roundup does. Now, here's how we detoxify pesticides. Citrus pectin, grapefruit seed extract, milk thistle, and N-acetylcysteine. That's a great way to detoxify the glyphosate on foods. Now, people will say to me, Dr. Gill, you say we have less minerals in the soil. You say that plants aren't as healthy because of it. So if you use animals and you use plants to build the products you carry, the nutritional products you carry, how are they healthy? The companies we use own everything from the farm all the way up in production to where we hand the bottle of whatever it is to you. They own the tractors, they own the farm, they can control the soil, they can grow the better product. I've been out to some of these places and it's amazing to me when I went there to see the level. It's like Intel. At Intel they wear these space suits but they can't get one bit of speck of dust in anything. When they're in there, they check the nutrients 3 times for herbicide, fungicide, pesticide. They have a special machine that makes sure the bottles are clean and sterile before the pills go into them. It's absolutely amazing. Here's Dr. Tent with the actual tractor guy at Standard Process to show you that they control all the way down to the soils and the tractors that plow the soils and how they take care and manicure the soils. That's why the products we have are so much better. Pharmaceutical grade, lot numbers, all of it. It's pretty intense how they build these products. Heart attack survivors may benefit from taking high-dose multivitamins than statins, suggests a study. Heart attack survivors may benefit more from taking high-dose vitamins than statins. Vitamin C. Vitamin C, actually, if it's low in the body, will be replaced by lipoprotein A in the cell wall to support the blood vessel. I'd rather have the vitamin C than lipoprotein A in that blood vessel wall. However, experts note that taking vitamin C through diet is not realistic. They explain that for its benefit to heart health to take effect, a person would need to consume dozens of oranges and bushels of red peppers a day. That's more than most people are willing to or able to eat. Instead, they recommend taking supplements. Here's some of our vitamin C that we carry in the office. Every one of those is a great product. Vitamin K and K2. Which form benefits cardiovascular health? Basically, K1 is your clotting factor. K2 is the one for the cardiovascular health. Lower congestive heart disease risk is not linked to vitamin K1 levels, which suggests that K2 is likely responsible for the heart benefits associated with vitamin K. Vitamin D can help. Vitamin D helps immune cells prevent atherosclerosis and diabetes. It's also very good for your immune system, which we'll get into. Here's some of the vitamin Ds we carry. The one on the end here is vitamin DK, so it has the K2 in it. We use that for the people that have the bad arteries or clogged arteries. I often say if we don't have it, you don't need it. What does the science say? What does the science say? This implies that vitamin D will reduce these properties in immune cells to decrease inflammation and reduce the risk of cardiometabolic disease. Vitamin D helps ensure that these nerves have access to calcium they need to function, helping to maintain healthy communication between the nerves and your heart muscle. Potassium also has a positive effect on your heart. Like vitamin D, potassium aids in nerve transmission, and the nerves that maintain your heartbeat rely on potassium to function. Like potassium, niacin, also known as B3, has an effect on your heart due to its ability to lower blood pressure. How to stop heart attack and irregular heartbeats in their tracks. The herb hawthorn berry is particularly potent in normalizing irregular heartbeats in short order. Often a person with irregular heartbeat will find their heart rhythm beginning to normalize in just a few minutes after taking hawthorn berry. How to stop heart attacks and irregular heartbeats in their tracks. Sometimes called the king of herbs, cayenne pepper has the ability to stop a heart attack in its tracks, like we talked about earlier. The best form of cayenne pepper to use to stop a heart attack is cayenne pepper tincture, and it only takes a couple of dropperfuls to do the trick. Might not be a good or bad idea to have the cayenne pepper around the house. Studies suggest an increase in DHA omega-3 intake can help lower the risk of aortic calcification in men. Calcification of any blood vessel is dangerous, but it's especially bad if the condition affects the aorta. Remember, that's where the coronary arteries, the openings, come off at the aortic valve area. They learned that every 2% improvement in DHA levels reduces aortic calcification by 35%. Only DHA appears to possess anti-atherosclerotic effects that protect the aorta from the calcification process. So, here are some of our fish oils. The one in the middle is a favorite of mine, omega-3 EPA DHA, made from anchovies and sardines. The companies will take out the glandulars, they'll extract the glandulars from the fish, then cold press it. That's what you want to use because the glandulars is where you hold all the toxins. But any one of these oils is a home run. I always say don't use one, use several. 3 or 4 different oils, take a different oil each day. You want to get the full benefit. Magnesium can improve heart health and prevent heart attack deaths. Now some hospitals, when you go in with a heart attack, will basically give you a bolus of 800 cc's of magnesium to help with that heart attack, along with epinephrine or whatever else they're using. But it can even be called an essential nutrient for preventing heart attack. Now magnesium is the most deficient mineral in the United States. I don't know too many people that don't need some magnesium. Research has concluded that intravenous magnesium can reduce the odds of heart attack death when given to the heart attack patient immediately after the onset of the heart attack. This is one of the magnesiums I like to use, magnesium citrate, MGzyme. This is the magnesium that'll help you poop. It's a fantastic magnesium, relaxes you, puts you into REM sleep if you need some help sleeping. But I use this quite a bit. I find it to help with the heart palpitations, especially for when you have poor bowel function. Why is bowel function so important? Well, we get rid of what? For women, there's 3 different estrogens in the body, 80-10-10, and how it goes is estriol, estrone, estradiol. When you're done with those estrogens being utilized in your body, they attach to bile acid and go out through the back door. That means if you're not having regular bowel movements, what has to happen? Your body will reabsorb that estrogen and put you in an estrogen positive state. Regular bowel movements help to keep that estrogen that's already been utilized in your body out. You don't want to keep that estrogen in. The other thing is it also affects thyroid hormone. When you have regular bowel movements, thyroid hormone will be excreted too, the ones that are already utilized. I've had patients where I increase bowel function and their need for thyroid medication goes down because you got rid of that thyroid medication that was already utilized. Turmeric compound reduces bypass heart attack risk by 56%. Didn't they get the bypass to stop the heart attack? Turmeric compound reduces post-bypass heart attack risk by 56%. Okay. I'd use the turmeric. It's great stuff, great for inflammation. Benefits of turmeric compound. Published in the American Journal of Cardiology last July, found that the administration of curcuminoids, natural phenols, within the spice turmeric reduced the frequency of myocardial infarction, heart attack, after coronary artery bypass in a group of 121 patients randomly selected to receive a placebo or 4 grams a day beginning 3 days before the scheduled surgery and continued until 5 days after the surgery. Turmeric is wonderful for inflammatory conditions as well. Curcumin reduces heart enlargement and may prevent heart attack failure. Eating curcumin, a natural ingredient in the spice turmeric, may dramatically reduce the chance of developing heart failure. Curcumin's ability to shut off one of the major switches right at the chromosome source where the enlargement and scarring genes are being turned on is impressive. The beneficial effect of curcumin are not strengthened by eating more of it. Here's the turmeric we use, turmeric forte. A few tablets of that a day will do the trick. Try harder. Study seeks to discredit the benefits of vitamin D despite multiple studies that say otherwise. I think there's plenty enough study out there to show that vitamin D is very effective in helping the immune system. Reduces the odds of developing heart disease. Now, what is D-ribose and how can it boost your heart health? A team of researchers from Germany and the US assessed the effects of an oral D-ribose supplementation in individuals with chronic coronary artery disease and chronic congestive heart failure and found that D-ribose can boost cardiac function. Therefore, D-ribose supplementation can potentially be used as the alternative treatment for chronic coronary artery disease and congestive heart failure. Vitamin E treatments can prevent muscle damage after a heart attack, says scientists. Now, after a heart attack, another thing I would check is testosterone levels. A lot of times it'll lower testosterone levels. And to show you the benefits of nutrition, stick around because at the end of this talk, there's going to be a very important video I want you to see on what you can do with nutrition for these post-heart attack patients. But 647,457 deaths are due to heart disease, 805,000 Americans having heart attacks every year. Medications are currently unavailable to reduce the cardiac damage caused by overshooting inflammation. CoQ10 helps relieve symptoms of congestive heart failure, prevents premature death in patients. Extensive studies suggest that the antioxidant property of CoQ10 can be utilized for the treatment of cardiac conditions. Remember, if you're on those statins, what statins do is one of the things they block is that production of ubiquinone known as CoQ10. You definitely want to be on some CoQ10. Another product we have is CoQzyme 100, which usually I can give 1 tablet a day and reduce all those muscle pains they get from some of those statins. CoQ10 supplementation also improves overall blood circulation and stimulates the production of adenosine triphosphate, which we know as ATP, which is the energy molecule of life. A team of researchers from Duke University School of Medicine in North Carolina found that CoQ10 supplementation can improve symptoms of congestive heart disease, or congestive heart failure, excuse me. Now, Cindy here does echocardiograms. She's going to be coming into the office, call to schedule an appointment, but we're going to do echocardiograms. Here's what I envision for the clinic. Doing an echocardiogram, doing some blood work, putting the two together, putting a protocol together, and then redoing an echocardiogram and blood work 8 months to 12 months later to show the difference. There's no better proof than proof in the pudding. This is the video I want you to watch. One more click. My mom eating a bag of chips, doing her paperwork for her business at night. If you remember, my mom years later had a heart attack. And usually when you have a heart attack, you have a scar in that area on the heart that won't beat anymore. I want to show everybody the power of nutrition and what it can do for you. I'm going to introduce Cindy here. She's going to tell you a little bit about herself. Then she's going to tell you what she saw on my mom's heart. Cindy?
Hi, I'm Cindy Valentine. I'm with Know Your Health now. And we did do a screening on Dr. Gill's mother. And I did see the scar from the heart attack. And it was an interesting exam because generally, like Dr. Gill said, after a heart attack, that muscle tissue quits pumping. And on Dr. Gill's mother, with the aid of nutrition and good care, that muscle tissue was squeezing and doing its job. We could still see the scar from where the heart attack occurred, but the heart attack, it was no longer, it didn't affect that heart area anymore, so she still had very good cardiac function, despite having had a very significant heart attack.
This is the kind of results we can get with good pharmaceutical grade nutritions that work well. This is why we carry the Better Nutrition at the office. So to go over that again, when you have a heart attack, that area of the heart attack will scar on the heart. That part of the heart usually never beats again. At least that's what we were told. My mom comes in after her heart attack, and what had happened was we run blood work about every 6 months, tweaking or advising what nutrition to do. What they found is when they did the echocardiogram, the scar where it occurred on her heart was actually contracting with the rest of the heart like it's supposed to. Cindy had told me, she said it actually gave her chills because she's been doing echocardiograms for 35 years and has never seen that before. That's what nutrition can do. Now, another patient came in, 6-year-old male. He was suffering, he had a heart attack 20 years ago, and he was suffering from fatigue, shortness of breath, low endurance, air hunger, no get up and go, muscle pain all throughout the body. Now, he was on statins, and so he came in, and when he came in, his CK total was 685, which is off the charts. Creatinine kinase is off the charts. So I asked him, I said, did you have your isoenzymes run? He said, no, the doctor I'm with just basically said it's your muscle. He assumed it was his muscle because of the statin drugs he was on. So I said, we better run these because we got to find out, is it coming from the brain, is it coming from the heart, or is it coming from the muscle? Without the isoenzymes, you have no idea. There's no way of predicting it. So we ran the isoenzymes, and lo and behold, it was coming from the heart. So his cardiologist said, there's no way, by the way, there's no way anyhow that you can reduce those CK enzymes. So we put him on the proper supplements. On 9/13/19, his blood work showed his enzymes to be 501. They were 685, so they're already showing signs of dropping. On 10/7/19, the blood work showed him to be 430. Now, the patient stopped the supplements because he's a contractor, he got busy. He just told me, you know, I forgot, doc, I don't have time to get over there to get them. They went back up on 12/4/19. It went back up to 734. He returned. We put him back on the nutrition that he needed because he realized he wasn't feeling so good. Once he got back on the nutrition, on 2/19/20, his blood work showed it to go back down to 423. Now that's still elevated, but if he stays on the supplements, I just saw his wife a couple weeks ago, helped her with another situation. She said, he's coming back in, Dr. Gill, now that you moved over to DHS. He just hasn't got there yet. But this was told, he was told that you can't reduce the CK, the creatinine kinase, and the nutrition took it right down. So, what are some of the blood works that we would run, or some of the blood markers we'd look for in cardiac patients? Apolipoprotein B, lipoprotein A. Now, for the docs out there, lipoprotein A should be twice as high as lipoprotein B. When lipoprotein B starts to approximate that A, it starts to come up, what happens is you can guarantee that patient is plaquing. You want to get right after it. Remember, lipoprotein A is associated with HDLs. Lipoprotein B is associated with LDLs and VLDLs. We also would run the C-reactive protein to look for inflammation, homocysteine, the genetic marker that would cause plaque in the arteries, which is simply reduced by using certain nutrients, creatinine kinase like we did on the other patient, Brian, and then if needed, if these are off the charts, we run the isoenzymes. That's some of the things that I would run on blood work. Monocytes would be good too, sometimes a comprehensive. That concludes my seminar. We want to thank you for coming out, listening to the seminar. Remember to shop local. Remember to get out to those farmers that have that tomato that looks like it's bruised. It's better for you. Don't go for that store-bought tomato that looks the size of a bowling ball and all shiny and crisp. Support the local businesses. DHS does their best to support the local businesses as much as we can. I hope by this talk tonight you saw my passion for trying to get people well. Thank you for coming out. I look forward to the next lecture. Don't forget, I'm going to be doing that blood type lecture to teach you the different blood types and how different nutrients respond to the blood type. Thank you and God bless.